In this video, I will explain what is prostate, what is BPH, what are the different procedures for shrinking prostate, steam therapy for enlarged prostate, procedure, benefits, and side effects. What is prostate? The prostate is a gland of the male reproductive system. In adults, it is about the size of a walnut and has an average weight of about 11 grams, usually ranging between 7 and 16 grams. The prostate is located in the pelvis. It sits below the urinary bladder and surrounds the urethra. The part of the urethra passing through it is called the prostatic urethra, which joins with the two ejaculatory ducts. Bladder, prostate, urethra, ejaculatory duct. Its primary functions are to create fluids in your semen and force semen through your urethra when you ejaculate. Also, playing a role in hormone production and helping regulate urine flow. What are the common conditions and disorders that affect the prostate? Benign prostatic hyperplasia. BPH causes your prostate to grow, which can cause blockages in your urethra. Inflammation, prostatitis. 4 different prostatitis conditions cause inflammation in your prostate gland. Acute bacterial prostatitis, chronic bacterial prostatitis, chronic pelvic pain syndrome, CPPS, and asymptomatic inflammatory prostatitis. It's the most common urinary tract issue in men younger than 50 and the third most common in men over 50. Prostate cancer. Prostate cancer is the second most common type of cancer that affects men. Different procedure for shrinking prostate. Medication management. Medications have been developed to relieve the symptoms of benign prostatic hyperplasia, or stop prostate growth and shrink the size of the gland. Lifestyle changes. Avoiding liquids a few hours before bedtime or before going out. Limiting caffeine and alcohol, as these may stimulate the urge to urinate. Eating a low-fat diet. Eating a large variety of vegetables each day. Eating a few servings of fruit daily, and be sure to include citrus fruits. And avoiding sugary drinks. And participating in moderate to vigorous physical activity most days of the week. Being physically active for at least 30 minutes every day. Bladder training. Kegel's exercise pelvic floor muscle. Exercise. 1. Sit, stand, or lie down where you're comfortable. 2. Squeeze your pelvic floor muscles and hold. 3. Start by holding for 3 seconds, then releasing for 3 seconds. 4. Repeat 10 times. 5. Each week, add 1 second to get to 10 seconds each time. 6. Try to work up to doing 3 sets every day. 5 steps to bladder training. Step 1. For 1 or 2 days, take note of how many times you urinate or leak. Step 2. Each day calculate the number of hours you wait between each urination. Step 3. Based on your calculation, choose an interval long enough to hold between urinating. Step 4. Empty your bladder first thing in the morning. Add 15 minutes to each holding interval we calculated before. Each day. Continue with this training. Step 5. Once comfortable with this schedule, increase the interval by another 15 minutes. Surgery. With BPH symptoms, if you don't get enough relief from medicines, prefer not to try medicine, are not able to pee, have kidney problems, keep getting bladder stones, blood in the urine, or UTIs. Surgery, or other procedures, might not be an option if you have an untreated urinary tract infection, urethral stricture disease, a history of prostate radiation therapy or urinary tract surgery, a neurological disorder such as Parkinson's disease or multiple sclerosis. There are many types of surgeries and other procedures that can treat an enlarged prostate. Transurethral, incision of prostate, TUIP, transurethral, resection of prostate, TURP, laser prostatectomy, transurethral, microwave, thermotherapy, 2MT, prostate lift, embolization, Rezūm Steam Therapy, aquablation, transurethral incision of the prostate, 2IP. A lighted scope is inserted into the urethra. The surgeon makes 1 or 2 small cuts in the prostate gland. This makes it easier for urine to pass through the urethra. 2IP might be an option if you have a small or slightly enlarged prostate gland. It also may be an option if you have health problems that make other surgeries too risky. 2RP, transurethral resection of prostate. This is the endoscopic surgery, where endoscopy is passed through the urinary passage or through the penis. And under vision, the prostate is cut in pieces, and these pieces are removed through the endoscopy itself. The energy used to cut the prostate is electrical energy. Laser prostatectomy. This also an endoscopic surgery same as TURP, where here, the energy used to remove the prostate is laser. A laser is used to melt away, vaporize, excess prostate tissue, and enlarge the urinary channel. There are various subcategories, because the various lasers are used in the treatment of prostate. The commonest used laser is holmium laser. Others are diode, green light laser. Transurethral microwave thermotherapy, TUMT. A special catheter is placed through the urethra into the prostate area. Microwave energy from the catheter destroys the inner portion of the enlarged prostate gland. This shrinks the prostate and eases urine flow. TUMT might relieve only some of your symptoms. It also might take some time before you notice results. In general, the surgery is used only on small prostates in special situations, because the treatment might be needed again. Prostate lift. Special tags are used to compress the sides of the prostate. This can improve the flow of urine. A prostate lift might be an option if the middle section of the prostate gland doesn't get in the way of urine flow. It's less likely to cause sexual side effects than are many other surgical treatments. Embolization. In this procedure, the blood supply to or from the prostate is blocked in chosen areas. This causes the prostate to get smaller. Not recommend this procedure over other because of complications.
Rezm Steam Therapy, or water vapor thermal therapy for prostate enlargement.
Rezūm Therapy is a minimally invasive non-surgical treatment for benign prostatic hyperplasia, BPH, that has good long-term results. It involves a special instrument that uses water vapor, steam, to shrink the enlarged areas of your prostate. The instrument goes through your urethra, so you won't have incisions or need stitches. A healthcare provider will numb the area before the procedure to reduce discomfort. Another name for Rezūm is water vapor therapy. Before Rezm Therapy, a healthcare provider will instruct you to use the restroom. They'll then use a local anesthetic to numb your urethra and prostate to make you more comfortable during the procedure. A urologist will then insert a handheld device with a long, thin tube at the end into your urethra. A tiny needle releases from the end of the tube and delivers steam into the enlarged areas of your prostate. The steam destroys the prostate cells, causing the enlarged areas to shrink. You'll use a urinary catheter for several days until the swelling goes down. How long does Rezm Therapy take? Rezm Therapy usually takes about 30 minutes. Each individual treatment takes about 10 seconds. Up to 15 treatments can be given during one procedure. What are the potential benefits of Rezm Therapy? Rezm Therapy is a safe, effective treatment for BPH with good long-term results. You no longer need to take BPH medications. Many people see improvement in their BPH symptoms within a few weeks. It preserves sexual function. It's an outpatient procedure. You can go home the same day as the procedure. You don't need general anesthesia. Quick recovery period. Is a safe, effective treatment for BPH with good long-term results. You no longer need to take BPH medications. Many people see improvement in their BPH symptoms within a few weeks. It preserves sexual function. It's an outpatient procedure. You can go home the same day as the procedure. You don't need general anesthesia. Quick recovery period. You can repeat the procedure if your BPH symptoms return. How successful is the Rezm procedure? The Rezm procedure's success rate is good. Studies show that less than 5% of people need additional procedures or surgeries within 5 years after the procedure. About 10% of people need to take prostate medications within those first 5 years. How many years does Rezm last? Rezm therapy is a relatively new procedure. The U.S. Food and Drug Administration, FDA, approved Rezm therapy in 2015. Medical outcome studies indicate that Rezm therapy effectively treats BPH symptoms for at least 5 years. What is the downside of Rezm? Though the Rezm procedure is relatively safe, there are some risks, including pain or discomfort while peeing or ejaculating, peeing more than usual or having more urgent urination, blood in your pee, hematuria or semen, hematospermia, urinary tract infection, UTI. Your penis doesn't release semen when you reach sexual climax, dry ejaculation, narrowing of your urethra, urethral strictures, bladder stones. How long will it take for me to feel better after Rezm therapy? During the first few weeks, your BPH symptoms may get worse before they get better. Many people notice an improvement in their symptoms after several weeks. However, it may take up to 3 months to see a difference. The following instructions can help make your Rezm procedure recovery easier for you. 1. Rest. Your body needs time to heal after Rezm therapy, and rest is essential for your recovery. Spending at least a day at home resting after your Rezm procedure is a good idea. It's okay to drive yourself home after the procedure and walk short distances, but avoid running, heavy lifting, bike riding, and other strenuous activities for a few weeks. 2. Avoid sexual activity. Avoid sexual intercourse and masturbation for a few days to help allow the area to heal. 3. Drink plenty of fluids, especially water. Drinking lots of fluids helps flush blood out of your pee. 4. Avoid fluids that may irritate your bladder. These may include drinks that contain caffeine, tea, coffee, energy drinks, carbonated beverages, seltzer water, soda pop, and citrus fruit juices, orange juice, grapefruit juice. When should I call my healthcare provider? Schedule a follow-up appointment with your healthcare provider 2 to 3 weeks after Rezm therapy. They'll want to see how you're healing. Call your healthcare provider if you experience any of the following during your recovery. Inability to pee. Severe pain. A fever higher than 101 degrees Fahrenheit, 38 degrees Celsius. Chills. Diarrhea. What is the difference between aquablation and Rezm therapy? Aquablation is another treatment for BPH. Like Rezm therapy, it uses water to remove prostate tissue, but it uses a high-pressure, heat-free water jet instead of steam. Rezm therapy is a minimally invasive procedure that a healthcare provider can perform in an office setting. Providers must perform aquablation in an operating room. With aquablation, the healthcare team removes the enlarged prostate tissue immediately. With Rezm, steam damages and shrinks the tissue over several weeks to months. Aquablation typically has faster and more dramatic improvements in your ability to pee. Patients undergoing aquablation therapy receive the treatment under general anesthesia and are usually admitted to the hospital, so they should anticipate spending at least 1 night in the hospital. Aquablation therapy is the only procedure that removes prostate tissue with a robotically controlled water jet. This robotic technology minimizes human error in removing prostate tissue and ensures the prostate tissue is removed precisely, consistently, and predictably.